So you were infected with the SARS-CoV-2, commonly called the coronavirus, and recovered as well. And now you think that you are immune for life. Think again. Isolated cases of reinfection of the Covid-19 coronavirus are being reported from across the world and even within India. The first case came in August when a 33-year-old man in Hong Kong had caught the infection again during a stint of his travel in Europe. A routine check at the airport found his report again to be positive. And not just that, even scientists and researchers in Hong Kong detected a case where a man was reinfected by the virus 4.5 months after he recovered from Covid-19. After studying that case, Hong Kong researchers revealed that the genome sequence shows 2 strains of the virus that could be clearly different. That's why they decided to also term it as the first proven case of the virus. Now remember, in the month of August, just days after the Hong Kong announcement, even Health Minister of Telangana announced that 2 medical professionals have again caught the infection of coronavirus of SARS-CoV-2, thereby referring to a reinfection as well. Not just that, very recently on September 5 in Karnataka as well, there was a reinfected case confirmed. It was at a Fortis hospital. A woman was confirmed to have transmitted the infection again. Both times she had mild symptoms, including a bit of fever. However, the World Health Organization has warned against jumping to any conclusions just yet due to one patient or even just a few isolated cases as well. Interestingly, even the Indian Council of Medical Research did mention in a press briefing that there can be reinfections of Covid-19, but it is not a case of concern yet, with just few cases emerging, and importantly, the reinfections are being reported as more mild in nature compared to the first case. Could there be a case of testing error with regard to reinfections and positive reports for the second time? That seems to be a question raised by Nagaur Member of Parliament Hanuman Benewal, because just a few days ago, for a routine Parliament test, he got his Covid-19 test done, for which the report came positive, thereby referring that because he had recovered from Covid-19 just about a few weeks ago, had he caught the infection again. But then he went on social media site Twitter and shared 2 reports. One, as was done in the Parliament, another a test done by a lab based in Jaipur, and that report had come negative. And then he decided to put forth a question: you tell me, which report should I believe? Centre for Disease Control and Prevention have also stated in a report that for the next 3 months, since a person catches Covid-19, there could be perhaps a slight strain of the virus even then. Remember, this is still a new infection and there is very limited data, and it is still being studied of how people are reacting to it. Meanwhile, experts and researchers at King's College London have also suggested that levels of antibodies that kill coronavirus can reduce over the 3-month study as well. Remember, for example, the common cold immunity is very short-lived and people can catch it again within the same year as well. Experts suggest, based on this limited data that is still being studied of the Covid-19, that in some individuals antibodies may not develop, and sometimes the immunological memory response can also be short-lived. And therefore, in some people, perhaps they can develop an immunity memory that can help them and protect them for the rest of their life. In either case, remember, the COVID vaccine is still not out. Clinical trials are still underway. Therefore, it is only your body that is developing immunity response, or primarily the antibodies, which means every body reacts differently to specifically a developing virus. So even if you have been infected already, continue to take as many precautions as you were doing earlier. It is best for you, for people close to you, and importantly, better for public at large.